thanks AIOCMTC1 conference and LOC, Chairman Scientific Committee, giving an opportunity to me to speak in various sessions of this conference. It's a really wonderful conference. We have enjoyed these last 3 days. So my topic today is traumatic cataract, a community perspective. It's a thanks to all of you making this possible. So eye injuries are very common, with up to 1/5 of adults having an eye injury at some point in their lives. Each year, more than 55 million eye injuries are serious enough to restrict activities for at least a day, and nearly 7.5 lakhs eye injuries require hospitalization, and many more than that. And ocular injuries, one of the leading cause of blindness and visual impairment amongst them. And the most common cause of this is road traffic accidents due to increase in urbanization, industrialization. Number of motor vehicles on the road have increased, leading to accidents. And also due to a lot of domestic violence, you get this type of ocular injuries, industrial accidents, and sports injuries. So I will be highlighting the road traffic accident because it's the most common nowadays in the modern era. A lot of people, they die, and if they die also, they survive also, they get a lot of injuries. They recently must have seen one of our cricketer had a lot of, luckily, he had no doubt injury over the face, but he has escaped the eye injury. This is one of the studies by wagon ticket case. They said that the incidence of ocular trauma is highest in the age group of 31 to 40 years. Very common because race driving is one of the most common causes. This again, males over outnumber the females 88%, and more. They measured the patients from the rural areas, they will suffer 70%, 30% from the urban areas, but I don't think this is true nowadays. And 80% of the patients present the closed globe injuries and 20% the open globe injuries. And while 34 patients present to the hospital, this is road traffic accident, very common, 56% of the road traffic accident, others, rest 45 patients. And as far as in their study, road traffic accidents were the most common cause of ocular trauma. And most of these injuries are due to high speed, bad roads, drunk driving, use of mobile phone while driving. This is the most common cause of road traffic accident, and not using proper safety measures and animals in the roads in some of the villages. And we have also done a study in the long time back. Mostly we concentrate on the road traffic accidents, and we have 265 eyes in 210 patients. We have got a 82% closed globe injuries, 17% the open globe. And our study, there are male outnumber the females, 82% males, and 24% had consumed alcohol, 34% were using mobile phone while driving, and 62% bike rider did not wear helmet. That's the most common. And sometimes bystanders standing on the road also get the injury. So ocular injury profile, various ocular injuries have been seen, out of which I say that trauma in the lens was found very common, and traumatic cataract is one of the common affection. This is usually due to a blunt or penetrating trauma involving the eye from the accident or violent attack, and it may develop within weeks of an injury to the patient and the lens, or sometimes it can take months or even years. So all the patients having any injury at any time should be followed up regularly. Case history, this is a 50-year-old man reported to us with a gross diminution of vision in the left eye, having sustained trauma in the long time back, 6 months back. And on examination, his right eye was normal, having 606%, where the left eye showing clear cornea with irregular pupil, vitreous in the pupillar area with subluxated cataractous lens, having handman's vision with good projection. And how did you manage? We managed with the VR surgery, scleral fixed IOL. This is the small video.
We can increase the volume if you want.
Can you go to sound? But you know, we got the titles. No. This surgery is being done by my daughter-in-law, Dr. Shweta Patra. Recently, she has completed her vitreoretinal fellowship at Coimbatore. Thank you. So patient is doing very well now. I got a 6/18 vision in the, I think, first 1 week. The patient is under follow-up. So to conclude, as I told you, the road traffic accidents are very common. So strategy to reduce the incidence of eye trauma should be directed towards prevention by means of following: raising public awareness, simple, clearly worded leaflets, posters in the health clinics, displays, a demonstration, street theater, role play, all should be done to raise the public awareness. Implementing eye safety programs using the media, especially radio in rural areas, introducing legislation, seat belt, helmet law and other driving penalties have also been proved to be life-saving, and occupational health and safety devices in the workplace. So these are to be improved. So mass health education, awareness about the risk of ocular trauma, morbidity caused by delayed presentation, and need to adopt safety or preventive strategies should be focused, especially during travel, playground, and at workplace. So this is the community perspective. So I think ECOIN has the role to play, creating the, awareness about the road safety nowadays is the most important. Last but not the least, a strong appeal to all of you, humble appeal to again all of you. Please elect me by casting a valuable vote in favor of me for the editor proceedings. Thank you very much for patient listening.